Hi everyone, this is Dr. Karthik from AMSA Medical Center, Providence. Good to see you all again. Here today I am with another topic, hepatitis. So what is hepatitis? The inflammation of the liver tissues that damages the liver is called hepatitis. So liver is obviously the largest organ of our body and it weighs exactly 2% of the body weight. Say for example, if a person weighs 100 kilos, the weight of the liver will be 2 kgs. What are the functions of the liver? Liver usually does various functions. 3-4 important functions will be like it helps in digestion of the food, it aids metabolism, it helps in secretion of the bile, it detoxifies the blood and helps in storage of glycogen. What is hepatitis actually? Hepatitis can be acute or chronic. Anything that resolves within 3 to 6 months of time is termed acute. Chronic means if it takes a longer time, say for example more than 6 months, it is called chronic. And chronic stage, if left untreated, it may progress to liver damage, cirrhosis, liver failure, and then sometimes even cancer. Causes hepatitis. The hepatitis can be broadly divided into 2 categories: infectious, non-infectious. In the infectious, it is mostly caused by viruses. So first we'll discuss about the infectious part. So the viruses that causes hepatitis will be of 5 types: hepatitis A, hepatitis B, C, D and E. So the hepatitis A first is caused by hepatitis A virus. It is usually caused by the contamination of water and food with fecal matter. It is spread usually when the sewage polluted shellfish is consumed, when a person infected with hepatitis A is serving the food, in that means it is spread. Hepatitis B, it is caused by hepatitis B virus. It is usually spread by getting in contact with infected person's blood, semen, vaginal discharge, vaginal secretions, or even the blood products of the infected person. Sharing the needles, razors of the infected person, having unprotected sex with the infected person, or tattooing, body piercing, and more importantly, a mother can pass on this virus during delivery time to the child. The hepatitis C similarly is caused by hepatitis C virus, and it also more or less matches the hepatitis B, like it is in contact with, when it comes in contact with the infected blood during blood transfusion, sharing of needles, razors, unprotected sex. These are all the common modes of transmission of this virus. And hepatitis D is caused by hepatitis D virus, and hepatitis D usually doesn't occur alone. When hepatitis B occurs, it occurs in conjunction with hepatitis D, or in other words, the hepatitis D occurs in conjunction with hepatitis B. So because it needs the hepatitis B to multiply. And hepatitis E will be a waterborne disease. It is caused by hepatitis E virus. Usually it will be found in poor sanitation areas. So these are all the infection types. Coming to the non-infection types, alcoholic hepatitis. A person develops hepatitis by consuming a lot of alcohol. Autoimmune hepatitis is something where a person develops hepatitis after he is infected with something like multiple sclerosis, rheumatoid arthritis, psoriasis. Not everyone with this disease will develop hepatitis, but there are chances. And certain medications can cause, certain toxins can also cause. What are the symptoms of hepatitis? The symptoms, to be more precise, will be like loss of appetite, nausea, vomiting, pale stools, dark urine, abdominal pain, fever, sometimes jaundice. So acute hepatitis usually doesn't need treatment except for symptomatic treatments like nausea, vomiting, abdominal pain. The other things can resolve on its own. But if it is chronic, it needs treatment, especially for hepatitis B and hepatitis C with antiviral therapies. There are vaccinations available for hepatitis A, B and D. So the vaccine for hepatitis C is still under research. They have not come to a conclusion. The vaccine for hepatitis E is developed and it is available in China, but nowhere else it is available. And so if you find any of the symptoms, if you find any of the risk factors for yourself or with any of your relatives, neighborhoods, do consult your doctor, your physician, and give a proper history. The doctor, after observing the history from you, will come to a proper diagnosis. There are tests, including the blood test, to check how your liver works, called the liver function test, to check for the serology, which means the viral status can be checked, the autoimmune status can be checked, and also there are specific ultrasound scans, CT scans to check the structure of the liver and the surrounding organs to see if there is any fluid surrounding, any damage to the liver has been occurred. Treatment, as I said, there are no specific treatment for a chronic stage except for treatment with antiviral therapy for B and C. The World Hepatitis Day is observed on July 28th every year. The motto of the World Hepatitis Day is to bring the hepatitis care to you, nearer to you. So we all have to work together to eradicate this fatal illness. Take care of your health. Have a good day. Thank you.